Hello, this is John Wyatt. It's a genuine privilege for me to take part in this critically important religious freedom summit, choosing life in a culture of death. I'm so sorry I can't be with you today, but the topic is one I care passionately about. I'm a British physician based here in London, England, and I've practiced medicine for over 40 years. Over those years, caring for thousands of critically ill patients, adults, children and babies. And I'm a Christian believer who's dedicated his life trying to serve Christ in the wonderful and challenging vocation of clinical medicine, a vocation which Christ called me into over 50 years ago. And I'm trying to be his hands, the hands of Jesus with critically ill, suffering and dying people. And it's because of my Christian convictions and decades of practical clinical experience that I've been fighting against all forms of medical killing. I've given evidence in the British Parliament on several occasions. I've spoken repeatedly at ethical and meetings and conferences, public debates in the UK, and I've written several books engaging with the ethical, medical and spiritual issues. I've also had the privilege of travelling internationally and have engaged with physicians, parliamentarians, lawyers and activists in many countries in Europe, Asia, Australia and over there in North America. So what I would like to bring you today is an international perspective on euthanasia and mercy killing. I'm going to try to give you just a brief snapshot of what I think is happening across the world and where Canada fits into the overall picture. And then I'm going to look at some of the deeper medical and the spiritual issues which lie behind what is going on. As I look across the world, I see the gradual and insidious spread of medical killing, a tragic corruption and distortion of a noble and God-honouring profession, which used to be rooted in Christian foundations. You know, the medical historians are all agreed Western medicine has its roots in Christianity. The first hospitals, back in the first centuries after Christ, were created by Christian monks and nuns, and they were run by bishops of the church. And they cared for people in new ways based on the radical teaching and example of Jesus of Nazareth. They concentrated on treating the outcasts, the abandoned, the destitute, leprosy sufferers, plague victims. Why? Because of the teaching and the example of Jesus. Here in Europe, right up to the 20th century, most of the major medical centres were Christian foundations, many of them with their roots in monastic communities. I trained at St Thomas's Hospital in London, a proud Christian institution which had provided compassionate care for destitute people in London for 900 years. Everywhere you look in the history of medicine in the West, you see Christianity, Christian ethics, Christian thinking, Christian compassion, Christian respect for life, and the absolute prohibition of homicide and intentional killing and assisting suicide. But since the 1960s, there's been a slow, insidious spread of a corruption, slowly distorting and destroying centuries of Christian thinking and practice. The corruption starts before the Second World War, when the deliberately misleading term euthanasia, which simply means good death in Greek, was selected to describe mercy killing by physicians. To begin with, it's a purely theoretical idea, but then it's taken up by a group of physicians in Germany, headed by Karl Brandt, Hitler's personal physician. A nationwide euthanasia program commences in 1939, and by the end of the war it is estimated that Nazi doctors killed about 275,000 people. People with learning difficulties, with Down syndrome, with cerebral palsy, and thousands of children and babies. They were not killed by ruthless, brutal soldiers with machine guns. They were killed by sophisticated, intelligent and experienced doctors who claimed they were motivated entirely by compassion. After all, these were lives that were not worth living. As the news comes out after the Second World War, there's international revulsion and outrage. You would have thought that medical euthanasia would never again be countenanced. But 40 years later, in the 1980s, the Netherlands, whose population had suffered terribly under Nazi occupation, becomes the first country in the world to allow doctors to kill their patients out of compassion. Slowly, the corruption starts to spread. In the 1990s, there's the state of Oregon in the US, then Belgium, then some other US states, and now, tragically, legalized mercy killing is spreading across Western Europe, Spain, Sweden, Germany, Austria, and elsewhere. It's spreading to Australia, and it's there in Canada. In Canada, there were legal challenges going back many years. The case of Kay Carter in 2011 leads ultimately to the Supreme Court ruling in 2015. Medical killing starts in Canada in 2016, and it's been steadily rising year on year since then. And here in the UK, we are still holding out against this corruption, despite enormous pressure. There have been attempts to legalise euthanasia in the UK going back more than 100 years. But I'm pleased to tell you that at the time of this recording, medical killing is still completely prohibited by UK law. But there are continuous efforts to get euthanasia in by the back door. The euthanasia activists here point to successful, or what they claim are successful euthanasia laws around the world. They point to Oregon. They point to the state of Victoria in Australia. Interestingly, they never refer to Canada as a fine example to follow. In fact, the truth is that many euthanasia activists in the UK are embarrassed by what is happening in Canada. They would prefer that the British population don't focus too closely on Canada. So I'm sorry to have to tell you that Canada seems to represent internationally a warning of what can go wrong once you legalise medical killing, of how not to do it. So why is Canada seen as a warning to the rest of the world? Well, very briefly, here are a few pointers. I know that other speakers today will highlight some of these painful and tragic issues. And of course, they're speaking from personal experience, whereas I'm only looking in from over the pond. But here are 5 reasons why I think Canada is a warning to avoid. First, the Canadian law has notoriously vague wording, and this has allowed clever lawyers and activists to twist the meaning and change and extend practice. The wording started out as requiring a grievous and irredeemable medical condition that caused enduring suffering and where death was reasonably foreseeable. But all this vague wording has been challenged, and the latest version of the Act now talks about a serious and incurable illness, disease or disability. The person is supposed to be in an advanced state of irreversible decline, incapability, and enduring intolerable physical or psychological suffering. But in reality, what's happening in Canada shows that this wording is capable of remarkably flexible interpretation by physicians. 2, tragically, the experience of Canada shows very clearly a demonstration of what is often called the slippery slope. Once you introduce legalized killing, it seems impossible to stop the grounds extending in ways that were not originally envisaged. People with chronic disabilities, mental health difficulties, those unable to access proper social care, people in palliative care facilities. Soon, I'm very much afraid it's going to be children with terminal conditions, people with dementia, and even babies with brain damage. The numbers of people being killed are rising dramatically. The statistics show a 30% growth year on year. In 2022, 4 out of 100 deaths in Canada were due to medical killing. In 6 years, this cause of death has come from nowhere to one of the highest rates in the world. 3. In most countries, euthanasia is practiced in people's homes, outside of mainstream medical practice. It's completely separate from normal routine medical care. But in Canada, I understand, medical killing has become incorporated and integrated into routine medical care in all your major hospitals and facilities. 30% of all euthanasia deaths occur in hospitals. There are published care pathways for euthanasia which doctors and nurse practitioners must follow. Incidentally, Canada is the only country in the world that allows nurse practitioners to kill their patients. Training courses are provided for all health professionals. If you go into hospital as a patient and you meet the criteria, then you should be offered the option of being killed. In fact, it's extremely difficult, if not impossible, for hospitals and medical facilities to opt out of medical killing. This is part of routine and legally mandated care across the country. 4th, one of the most painful aspects for me personally is the way that palliative care, which was invented by Christians and was based on a Christian ethics and respect for life, seems to be becoming corrupted by medical killing. Now, 20% of all euthanasia deaths occur in palliative care facilities, and 8% of MAiD practitioners, so-called, are palliative care physicians. And finally, 5, Canada is leading the world in what is called organ donation euthanasia. In other words, the patient agrees that they will be put to sleep and then killed in an operating room, with a transplant team standing by so that the organs can be removed at the moment that death occurs and transplanted into a patient in another operating room. Doctors in Canada have performed almost half of the world's organ transplants after euthanasia. And at present, 6% of all organ transplants from deceased donors in Canada are now the result of euthanasia. Here's Arthur Schaffer, a leading Canadian ethicist. I was rather proud that Canada has done so well in terms of organ donation by MAiD patients. With more than 4,000 Canadians waiting for organ transplants, Canada's numbers show a strong move to turn death into a win-win. So I say, good on us. It's a wonderful opportunity for someone facing death to make something significant out of the end of their life. The terrible medical truth is that organs from euthanasia patients are of much better quality than those from patients who die naturally. In other words, just think of all the good you can do for other people if you only agree to let us kill you cleanly, using all our medical skill and expertise. So here are 5 reasons why euthanasia activists in the rest of the world tend to keep quiet about Canada. I'm afraid the country is providing the world with a powerful example of unintended consequences. The slippery slope over just 6 years, leading to medical killing, which is arguably on an industrial scale. In the rest of the talk, I want to look at some of the deeper issues. First from a medical perspective, and then finally from a spiritual and biblical perspective. So from a medical perspective, euthanasia has been known from ancient times. It was well known in the ancient Greek and Roman worlds, and the best people at killing were the healers, the herbalists, the medicine men of the ancient world. It was obvious that the person who knew most about powerful herbs would also know most about how to poison someone. He with the power to heal has the power to kill. He with the power to kill has the power to heal. So the healers of the ancient world were also the killers. But all this started to change with a group of pagan physicians who traced their origins to a mysterious Greek figure, Hippocrates, in the 4th century before Christ. And those physicians took a solemn and binding oath to use their professional skill only to heal and never to harm. And part of the oath they took stated, "I will not give poison to anyone, though asked to do so, nor will I suggest such a plan." For the first time in the ancient world, there was a clear line drawn between healing, caring, and killing. To begin with, they were a small and insignificant band of physicians, but when the early Christian church started their own hospitals and their own medical services, they adopted the pagan Hippocratic oath and they Christianized it. And so the prohibition on killing and on assisting suicide passed into legal and medical codes ever since. And for 20 centuries since Christ, every physician took a solemn and binding commitment to use their medical training and skill only to heal and never to kill. There was a clear, shining line between caring and killing. So there's a terrible irony that now across the world it is skilled doctors who have become the killers again. Talk about rewriting history. And at the same time, suicide, which was always seen as a terrible act of despair and hopelessness, is being gradually and subtly rehabilitated into a rational choice, even a noble and altruistic act to donate your organs and assist your relatives and loved ones. From a medical perspective, there's a vitally important distinction between allowing death to occur naturally on the one hand and intentional killing on the other hand. In the first situation, death is already present due to the consequences of disease. The physician and the healthcare team are able to hold death at bay for a period, but there is a time to say, enough is enough. And we take our hands away. We allow death to occur naturally. And when it's appropriate and taken at the right time and with the agreement of all concerned, this is an act of wise compassion. It's always been part of Christian medical practice. But withdrawing life-supporting treatment or invasive treatment is completely different from the physician's decision to introduce death, to kill rapidly and cleanly at the end of the needle using an intravenous cocktail of lethal poisons. This is medical execution. In trained hands, it's rapid, humane, clean. But calling it medical aid in dying is to use weasel words. It is intentional medical homicide. Euthanasia is usually presented as an act of compassion, but this is a slippery word, and compassion is a slippery concept. Compassion without boundaries can be very dangerous. I know some people with chronic disabling conditions such as cerebral palsy or multiple sclerosis, and they have said to me privately that they are literally terrified of becoming ill and requiring hospital admission. Why? Because they are fearful that whilst they are sick and dependent, some arrogant physician may have, quotes, compassion on them and deliberately fail to save their life. When you have decided that my life is not worth living, then your, quotes, compassion can literally threaten my existence. So yes, of course, as Christian physicians and carers, we are called to treat all those who are suffering and close to death with genuine Christ-like compassion. But compassion leads to a skilled palliative care, not to killing. Modern palliative care was invented here in London by a wonderful Christian physician called Cicely Saunders back in the 1960s. And palliative care spread out from its Christian roots here in London, and it went across the world. And right from the start, palliative care doctors were devoted to expert control of pain and unpleasant symptoms, but they were totally opposed to euthanasia. And one of Cicely Saunders' slogans was, "You don't have to kill the patient in order to kill the pain." And in fact, palliative care doctors have always been dedicated to help people live before they die, to make the most of the last hours, days, weeks of life. Over the last 40 years, I've had the privilege of personally practicing palliative care in dying adults, in children, and in many babies. And I've seen its extraordinary power to transform the dying process for good, a way of expressing Christ-like compassion in a practical and effective way, to transform the dying process from a lonely agony into even a strange adventure, a personal, relational, spiritual adventure of reconciliation, of growth, and of hope. That's not to say that all suffering can be abolished. I love the quotation that comes from the palliative care movement. Suffering is not a question that demands an answer. It's not a problem that demands a solution. It's a mystery that demands a presence. A mystery that demands a presence. And in my experience, there is no higher privilege than to try to be that presence, to be the hands of Christ, a skilled, caring, and compassionate presence in the mystery of suffering. But at its heart, euthanasia is not just a complex medical, ethical, societal issue. It is a spiritual attack from the hidden forces of evil, the powers and authorities in the heavenlies, to use the biblical term. It's a spiritual attack which goes to the heart of what it means to be human, to be created in God's image. So here are 3 things that we can learn about the evil one from the pages of the New Testament. First, he's a murderer. These are Jesus' words in John 8. "You are of your father the devil, and your will is to do your father's desires. He was a murderer from the beginning." So with spiritual eyes, we need to see the figure lurking behind that white-coated physician with a syringe in their hands. The evil one is a murderer, and he delights in the destruction of human life. And the idea that the killers in our society are not only brutal, sadistic murderers or Kalashnikov-wielding terrorists. No, the most productive killers in Canada today are skilled and dedicated physicians, compassionate carers. Can't you see that cynical smile and the evil one? So second, the evil one is a liar. Here are Jesus' words again. When he lies, he speaks out of his own character, for he's a liar and the father of lies. So can you see the figure who lurks behind all that euphemistic language about choice and control at the end of life, about medical aid in dying? I'm continually struck about how important language is in medical ethics. So often the manipulation of language precedes the corruption of behaviour. And all of this comes ultimately from that figure of evil who approached the first human beings in the garden with a lie. As Tim Keller put it, when Satan chose to attack Eve, he didn't do it with a hammer. He did it with a lie. Did God really say? It's the power of twisted language. So first, he's a murderer. Second, he's a liar. And third, he masquerades as an angel of light. Those are the words of the Apostle Paul in 2 Corinthians 11. So with spiritual eyes, can you see the figure that lurks behind all that verbiage about a win-win for people who need an organ transplant? Just think of all the good you can do by agreeing to be killed. This is an act of true altruism. Think how you are sparing your loved ones. Think how you are doing the best for your children. Think how you can prevent a terrible waste of resources. Just agree to be killed. You know it's the loving thing to do. I'm afraid it's the evil one who is turning the world of healthcare from participating in the works of the kingdom, healing the sick, helping the blind to see, saving human life, into the killing fields. The evil one despises, loathes, and hates human beings. Why? Because every human life is a precious and unique reflection of God. And every time the evil one sees a human being, he sees a reflection of the prince. And he loathes it. The evil one is dedicated to its destruction. A human life is not just a gift from God, it's a unique reflection of his character and being. Each one of us is made in that image. Each one of us, however much our lives are distorted by sin, by disease, or by malformation, each one of us is a precious and unique reflection, a mirror of the divine. And to willingly and wantonly destroy that precious, glorious, unique image is to spit in the face of Almighty God himself. It is to collude with the work of the evil one, the liar, the murderer, the deceiver. But it's not hopeless. You know, we are called by Jesus himself to be salt and light in our societies. And I find those metaphors profoundly hopeful because you only need a tiny amount of salt to act as a powerful preservative. And you only need a tiny amount of light to dispel a great darkness. So we don't despair. He that is with us is greater than he who is in the world. I close with the wonderful and challenging words that Moses spoke to the people of Israel and which lie behind the title of this meeting. This day I have set before you life and death, blessings and curses. Now choose life so that you and all your children may live.